everyone. This is Visionary Medical Sansar. Today's my topic is about C reactive protein, and as you see my lab text series, we have many lab tests to be studied and on. First of all, you're going with the primary and most aspects like how the disease is diagnosed in the first step. Like the doctor wants to know you are infected by a disease or not. We have to check not only disease, any injuries. Like first and foremost, if a patient goes to a doctor, he says he has fever, swelling, headache, etc. The doctor was seriously unknown first because he need to diagnose, no? Obviously, he need to diagnose. Without diagnosing, you cannot say whether the person is infected or non-infected or injured or non-injured. He may ask the questions like primary infection, like primary inspections. He can be like he can do it, and also by seeing your like visual inspection, he can do it. And for example, some other medical diagnosis like um, palpation, percussion for all kind of pain and glossiness. You can just examine him first primarily. After this, a doctor can make a diagnostic test like first basically for a person is infected or not. He just first the physician goes directly for a CRP test. What is CRP test? CRP test is a C-reactive protein test measure, which measures the level of C-reactive protein in the blood. First of all, what is C-reactive protein? The C-reactive protein is made by a liver, and it is sent into the bloodstream in the response to the inflammation. If a body is infected by any disease or an injury, first sign of defense mechanism is inflammatory response. You guys know about it. When the diseases affects us, first our immune system plans to give an inflammatory response that your body is infected or affected by some other cause which can harm you. So we start building our healing process. After sometimes, when the excessive production of our C-reactive protein is done, we can easily see in the blood that the person has high level of CRP level, so that he is infected by some other unknown disease. CRP is an asset of checking whether the person is infected or injured or not. Only till that aspect, it's a primary checkup, it's a primary diagnosis. We can just know by this. Okay, after inflammation is in your body way of protecting your tissues if you have been injured or infection. I have said already. A reactive protein, the C-reactive protein test measures the level of C-reactive protein. The C-reactive protein is made by liver in your blood. Your liver release CRP into your bloodstream in response to the inflammation. When your body encounters offending agents like virus, bacteria, toxic chemicals, or you have an injury, it activates your immune system. Primarily, it knocks the door. Like when a when a person comes unknown to your home, they just knocks the door, right? They knocks the door. Then you should open the door, and it may come in, they may come inside like that. The pathogen first knocks the door, starts knocks the door, and the door is our body to enter the body. Your immune system sends out its first responders first. If like you got like when your door is opening, first your door openers will be your father or a mother. Sometimes you will be directly involved, but like first and foremost, mostly our parents will open the door to See who's the knocker, who is knocking the door, like that. First of all, they will see like this. For that, the primary defense mechanism, inflammatory cells and cytokines are sent. These cells begin an inflammatory response. They start first, like they trap, they do their macrophagic activities against that bacteria and virus. They start, like they also plan of healing. They started healing and injured tissues for recovery process. This result in pain, swelling, brushing and redness. This is the primary signs of inflammation. And you can see why often healthcare providers perform CRP test. Healthcare providers typically order the CRP test to help the diagnosis or rule out certain condition, including severe bacterial infections such as sepsis and fungal infection, osteomyelitis, inflammatory bowel disease. Some What is inflammatory bowel disease? You can know that internal intestinal bleeding, etc. And some of arthritis and autoimmune disease such as rheumatoid arthritis, lupus, the systemic lupus erythematosus, pelvic inflammatory disease, and providers also can use CRP test to monitor people after surgery or other invasive procedures to check for inflammation during their recovery period. A CRP test alone cannot diagnose conditions or where inflammation in your body. Because of this only, the providers generally order additional test if the CRP result shows that you have inflammation. First of all, healthcare providers will check the CRP level. Then only they can move with some other test, bacterial test or malarial parasite test or tetan, like some other more tests for lab, so that they can first of all they need to know that you are infected, then only they can see what is the cause of infection, lead and localization, everything. And the normal CRP measurement is will be in the gram milliliter, milligram per liter. And results for CRP normally it should be below 10, should not be above 10. If some recently I've seen some one or two reports of my friends and colleague. It has they have started their disease. Their CRP rate was above 100 or above 20, above 40, above 50, above 60. Like in the primary level of admission, they have some people used to have 120, 140, etc. After the treatment, gradually the amounts will be decreasing. The CRP test is not only done in a single day, because they used to do is repeatedly, tandem repeatedly. They used to do for till the discharge, the day the person is getting discharged. So the CRP is a most vital response test, so that a person and the doctor can understand the recovery standard of a patient. Thank you guys, and hope you guys got need information. Catch you later with a nice video. Until then, bye from Missionary Medico Sansar. Thank you.